The dental mirror is used in 4 ways during instrumentation: indirect vision, retraction, indirect illumination, transillumination. Here, the clinician is using the mirror to view the lingual surfaces of the maxillary right sextant. This technique is known as indirect vision. Retraction is the use of the mirror head to hold the patient's cheek, lip, or tongue in order to view tooth surfaces that are otherwise hidden from view. Here, a dental mirror is used to retract the tongue away from the lingual surfaces of the mandibular teeth. Indirect illumination is the use of the mirror surface to reflect light onto a tooth surface in a dark area of the mouth. Here, a mirror is used to direct additional light onto the lingual surfaces of the maxillary left posterior teeth. Transillumination is a technique of directing light off the mirror surface and through the anterior teeth. As the light is reflected off the mirror surface, the light beams pass back through the teeth. Notice how the anterior teeth seem to glow with light from within as the light beams bounce off of the mirror surface and back through the teeth. Retracting the buccal mucosa away from the facial surfaces of the posterior teeth can be a challenging task, especially if your patient tenses his or her cheek muscles. Correct retraction technique reduces the likelihood of stress to the muscles of your non-dominant hand. Grasp the mirror in your non-dominant hand. Place the mirror head between the dental arches with the reflecting surface parallel to the maxillary occlusal surfaces in a frisbee-style position. Slide the mirror back until it is in line with the second molar. Position the mirror's reflecting surface by turning the mirror handle until the mirror head is parallel to the buccal mucosa. The back of the mirror head is against the buccal mucosa. Establish a finger rest on the side of the patient's cheek or on a tooth near the treatment area. Use your arm muscles for retraction. Pulling with only your finger muscles is a difficult and tiring way to retract the cheek. Technique demonstration: mirror use for indirect vision. The technique of indirect vision is an extremely important skill to master. This short activity will demonstrate the importance of indirect vision. Use direct vision to carefully view the facial aspect of this maxillary first molar. How many colored dots can you see? In this case, you are using direct vision with a mirror's reflecting surface against the buccal mucosa of the cheek. This time, use indirect vision and look in the mirror to detect the dots on the facial aspect of the molar. How many dots do you see now? What colors are the dots? If you looked in the mirror, instead of directly at the tooth, you should have seen 3 colored dots. The dot on the distofacial line angle was not evident with direct vision. If this dot was a supragingival calculus deposit, you would have failed to detect it. Did you notice that the clinician rotates the position of the mirror head in order to view the distal surface of the tooth? In this position, you have a clear view of the facial surface. Now, with a slight rotation of the mirror, the distal surface comes clearly into view. Remember not to maintain the mirror head in only one static position. Rotate it slightly to obtain a clear view of all 3 surfaces of the aspect. Technique demonstration: mandibular anteriors. Here, the clinician has the mirror surface parallel to the lingual surfaces. In this position, you have a good view of the lingual surfaces of the anterior teeth. Watch as the clinician rotates her hand slightly to position the mirror surface to view the mesial surfaces of the teeth. This is the mirror position for detecting calculus deposits on the mesial surfaces. Now the clinician repositions the mirror to view the distal surfaces of the teeth. Watch again as the clinician positions the mirror first to view the lingual surfaces, next to view the mesial surfaces, and finally, to view the distal surfaces of the lingual aspect of the mandibular anteriors. Technique demonstration: mirror use in posterior sextants. Mandibular right posterior sextant, facial aspect. Retract the buccal mucosa. Use the mirror for indirect vision, particularly to view the distal surfaces of the teeth. Maxillary right posterior sextant, facial aspect. Retract the buccal mucosa up and away from the teeth. Use the mirror for indirect vision, particularly to view the distal surfaces of the teeth. Mandibular left posterior sextant, lingual aspect. Use the mirror to gently pull the tongue away from the teeth toward the midline of the mouth. Once in position, the mirror is also used for indirect vision of the tooth surface. Maxillary left posterior sextant, lingual aspect. Use the mirror to reflect light onto the tooth surfaces. Rotate the mirror head for a clear view of the distal surfaces. Mandibular left posterior sextant, facial aspect. Use the mirror to retract the buccal mucosa down and away from the teeth. Once in position, the mirror also is used for indirect vision, particularly for the distal surfaces. Maxillary left posterior sextant, facial aspect. Use the mirror to retract away from the teeth. Once in position, use the mirror for indirect vision. Mandibular right posterior sextant, lingual aspect. Use the mirror head to push back gently against the tongue so that the lingual surfaces can be seen. Once in position, the mirror also is used for indirect vision. Maxillary right posterior sextant, lingual aspect. Use the mirror to reflect light onto the tooth surfaces. Rotate the mirror head to obtain a clear view of the distal surfaces. Then, reposition the mirror head to view the lingual and mesial surfaces.